Today we'll be talking about goniometric measuring. Just to recall, what I have here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. So first thing I will do is locate her axis, which will line up with the fulcrum, and that's at her greater trochanter. The best way to do that is to actually have the patient to bend their leg. You can follow their crease over, and I'll have her straighten her leg out. There I will place the fulcrum, also lining up the stationary arm with the midline just above her pelvis, and aligning the movable arm as close as I can with the lateral epicondyle of the femur. Now I will ask Sade to bring her knee to her chest. Okay, as I try to follow with her, what I also want to do is make sure that my fulcrum did not move and that all of my arms are where they're supposed to be. What we do understand is that the motion for hip flexion is between 120 and 140 degrees. And if she will straighten out her leg, I'm pinching this to hold it. And I will tell you that she said she had a workout before this, so she's a little tight, and she's measuring at about 105. Okay, so probably on another day she might be a little bit looser. So we're going to record that as 0/105. Thank you. Okay, the fulcrum is located over the greater trochanter. The stationary arm is along the midline above the pelvis. The movable arm is lined up with the lateral epicondyle of the femur, and we are at 0. So I will ask Sade to lift her right leg from the mat straight toward the ceiling. And I make my adjustments and ask her to lower her leg. And we have her at 25 degrees of extension. Keeping in mind the norm is 18 to 30 degrees.